Hi there. Is anyone joining us? Oh, there's Scott. Hi, Scott. Hi, Daphne. Can you all hear us?
I can.
Is that Daphne?
Yes, it is.
Hi, Daphne. It's Christy.
Nice to meet you, Christy.
Oh, you know what? I think we met in Salt Lake. I remember. You
Yep.
brought your graduate student, didn't you?
I did. You're
Yeah,
right.
I remember. Good to talk to you again.
Yes, it is. It's fun.
Some other folks on. Scott, can you hear us?
Yes, Scott and Kimberly are here on a speakerphone in San Antonio.
Perfect. Thank you, guys. And I see some others. I see a 210 number. Who's that?
Well, that could be us.
Oh, that might be you.
We're on phone, and then we're not doing the audio on Zoom. We're just doing the phone call-in.
Okay, perfect.
I'm trying to...
I see a 303 number. Is that maybe Kathy or Janet?
It's Janet.
Oh, hi, Janet. Thanks for joining us.
Yep. Good morning.
Sorry, we were having a couple Zoom gremlins this morning, so we apologize for being a little bit late to join. But we're on now, and Annette should be joining us in just a few minutes. She was having a little bit of trouble with her connection this morning. We'll just give it one more minute. So we wanted to just thank you all, Scott and Kimberly, for coming to San Antonio and joining us, to Austin and joining us for our state teams meeting. And Daphne is joining us. Daphne wasn't at our state teams meeting, but she reached out to Janet, I think. Didn't you, Daphne, with this?
Yes.
You were interested, yes. And I know you came to our last Utah meeting, Salt Lake City, Utah, when we were in our other grant cycle with the collaborative to our annual meeting. So thank you for joining us today. I just saw that Bill Morris is sick with the flu, so he won't be joining us. And I got a note that Rachel Lee has a doctor's appointment, so she might be joining late. So once Annette joins here, this might be all of us just to start. Oh, I see Kathy joined. Hi, Kathy. Oh, I think she's there. There we go. And Annette's on. Thank you. Yay, Annette, it worked. Can you hear us? Maybe not. Maybe not yet. Maybe it's still connecting.
Christy, can you hear me?
Oh, yep, we can hear you, Annette.
I had to use my phone because I guess when you logged in, everything started going like it was fading in and out. So I had to restart my computer, and it's not letting me do anything on this internet.
Okay, we're all here, Annette, so we're going to go ahead and get started with the meeting if that's okay.
Okay.
Okay, great. So again, thank you all for joining this call today. We want to first start off by introducing Annette to you all. Annette is our new project manager. She was, we interviewed her actually at the state team meeting in Austin before the meeting got started, and we are so excited that she joined us and got started with us last Monday. And so, Annette, are you in a place that you can talk and introduce yourself?
Yes.
Oh, good. Okay, go ahead. Tell everyone a little bit about yourself.
So before coming to Texas Health Institute, I had worked previously with DSHS for over 14 and a half years.
In Texas, right? Texas.
Yes.
Yeah.
At the Texas Health Department. And some of the roles that I was previously were I worked with the regional medical directors. And then in one of the other positions, I was the continuing education administrator for the CE program, which provided CEs for all the trainings conferences. And then I was a program coordinator for the resident preventive medicine residency program. And then in my last position there, I was a manager that oversaw all the adoptions for the state of Texas. And then in my last position, I worked at the Texas Department of Public Safety auditing FEMA payments for Hurricane Harvey. And now I'm at THI.
Great. And Mountain States, we're so glad to have you part of our Mountain States team. Thank you, Annette. And I thought it would be good, since Annette's new to our organization, if we could just do a little bit of an introduction for those of you that are on the phone, since she hasn't gotten a chance to meet you and wasn't at our state teams meeting. Scott and Kim, do you mind introducing yourselves to Annette?
Sure. I'm Scott McLean. I am a clinical geneticist in San Antonio. I work at the Children's Hospital of San Antonio. Oh, pardon me? I'm going to talk about myself a little bit more, just so that you know a little background. So I'm a pediatrician and a clinical geneticist. I spend all day seeing patients. Some of those are newborn screening follow-up patients or metabolic, but they're mostly clinical genetics. And I've been doing this for decades. So I've got a lot of gray hair. Sorry about that.
Oh, that's all right.
Been involved in sort of the newborn screening part of Texas for since the mid-90s, actually. So that's sort of my background. With me is Kimberly Nugent, who is one of our genetic counselors here. Kim?
Good morning, everyone. I'm Kimberly. I'm a mainly pediatric genetic counselor that works with Dr. McLean in all those little areas that he described, from general genetics to newborn screening and dabbling in a little bit of metabolic.
Great. And Dr. McLean, how are you feeling? I know you were just getting over the flu when you were in Austin. Hopefully you're back to full health.
Oh, I'm fine. I'm good.
Good. And Daphne, I know you're traveling today, but do you have a minute that you could introduce yourself to Annette?
Sure. Hi, Annette. I am a public health professor at Sam Houston State University, and I also have a grandson who's got a genetic disorder. And right now we're working with a project called Ryan's Challenge. It's for vascular Ehlers-Danlos syndrome patients and families. So pretty busy.
Great. Thank you. And I remember you brought a graduate student with you to our meeting in Salt Lake. Has she graduated?
Yeah, she's graduated, moved on. She's actually living in San Antonio looking for a job right now.
Oh, wow. Maybe we can recruit her on the team.
Well, she's a wonderful student to recruit. But I have 2 students this semester. So anyway.
Great. Well, thanks, Daphne, for reaching out to us and reaching out to Janet and being on the call today. So is there anyone else on the call that'd like to introduce themselves that's joined us from the Texas team? Just don't want to make sure I don't miss anyone. All right, go ahead, Kathy.
Oh, me? This is Kathy Hassel.
Kathy's on there. You just popped up.
What's that?
You just popped up on my screen.
Yeah, I think I'm not muted, I don't think. But can you hear me?
Yep, we can hear you.
Okay, it shows muted on my screen. So I'm Kathy Hassel. I'm the co-project director. Really, given the focus, Janet Thomas, my co-director, is the content expert. But I've been working with the Mountain States for a while now and hope to facilitate all the great work in all the states and as a region as a whole on behalf of people with genetic conditions.
And you're the honorary color commentator, right, for these calls?
That's right. I'm the one that's the cheerleader. Hey, we got money, we got resources, let's get her done.
We like to hear that. All right, so I know some of you are joining by phone. Maybe everybody won't be able to see this, but I'm going to take some notes on the screen. So I'm going to share my screen for those of you who can see it. The others don't worry about it. I'll send these out later. But we wanted to just have this call today just to reconfirm what we heard. Can everybody see that? Can everybody see my notes or Annette, can you see that? I think you're
I can see it.
Yep. Yes, I can see it.
Perfect. Okay. So we just wanted to reconfirm what we heard, what the Mountain States team's notes reflected of what we heard from the presentations on the second day of the state teams meeting in Austin. And so first, we wanted to start off by confirming the team members. So those that attended the state teams meeting included Debbie Friedenberg, who's in the newborn screening and newborn screening follow-up there at Texas Department of Health, Bill Morris, who's a consumer member of Gray's Gift, and Kimberly was there, and Rachel Lee, and then I know, Scott, I think you had to leave the second day, so you weren't there on the second day, but you are definitely part of the team, and so thank you so much for being on here today. And then we'll add Daphne as well, and to that list. So what we wanted to do today was confirm those team members, and also determine a team lead to see if there was anyone on the team that wouldn't mind being that point person, since Annette is new with us. Really just trying to have one point person per state for these state teams, that if she has an initial question about the team, or the management team has an initial question for the team, that we could go to one person as a point person. Again, this person would not be the person that does all the work. This person's not going to be tasked with, setting up meetings and coordinating everybody. Really just want to have that person be the point person for us. And also mention that we are sitting down with our HRSA funders once a month on conference calls as Mountain States. And so if they have any questions regarding Texas, that could be the first person we could reach out to, not to have all the answers, but to say, hey, you know what, I think so-and-so on our team might know more about that. And again, for Annette to have that contact. Would there be anyone that's on the phone today that would be willing to do that? Or we can wait till there's more folks till our next team call, which would be in March, to decide that. But if there's any willing volunteer today, I'd be happy to note it down. Don't everyone speak at once. No pressure. We don't have everybody here today, so we can delay that to the March call, unless anybody would like to do that.
Well, I think we should nominate Rachel since she's not here.
That's what I was thinking. We could nominate one of those folks, Debbie, Bill. We got a lot of people we could nominate. So, okay, we'll put that on the back burner for now, and go ahead on to the notes that we took through the state team presentation meeting, at which Rachel was one of the ones who presented that. And so, I did want to make one other note. Debbie Friedenberg did reach out to Title V and Ivy. I invited Ivy from the Title V department, and she, I believe, had a conflict for today, but I am going to note her down that she is interested. She got approval from her management to participate on the Texas State team. So we do have that connection as well for the Texas State team. And then I'm just going to shift gears here real quick and go ahead into the notes. Again, those notes, I copied them in the invite today. So if you want to reference that, where you had the Zoom number, those notes were cut and paste in that email. But basically what Rachel shared with everybody, and what came out of the team breakout session, which I believe, Kim, you were part of that, right? You were part of the breakout session that morning? Yes. Yeah. So these are some of the notes. I'll go through these quickly, but if you have any things that that we got wrong, we definitely want to correct these. But as far as underserved populations go, what was talked about was what is missing is El Paso, the Valley, the Panhandle, and some parts of East Texas due to geography, and then noting the large Hispanic population as well as an underserved population. The scenarios, I'll just remind you all briefly, and Daphne, I can follow up with you after this call with this sheet if you have not seen it. I'm not sure if you've been included on that. We handed out a one-page sheet of overview of the state teams, and there were 2 scenarios on that sheet, and this was really just to get people thinking at the state teams meeting about different functions of the team and initial state team tasks. So the first scenario is envisioning that a family is moving into your state that has a child with a rare genetic condition to a rural or otherwise underserved county, and they contact your team through MSRGN website about trying to find genetic services in the state, including primary care, specialty care, and community-based supportive services. How does this occur in Texas? And do we have the necessary information to provide to the family? So Texas State Team's response to that was, most information exists, but not together in one place. The webpage needs to keep this together with clinics also linked. Condition-specific support groups need to be listed or a link to a national database of those groups. The opportunities would be genetic centers provide different kinds of services, different levels. Families could have a checklist to know what kinds of questions to ask at their first visit. Does that, Kim, since you were the one on the call that was there, does that summarize pretty much your discussions around scenario 1?
That does, yes.
Okay, great. So I'll move on to scenario 2, which is HRSA asks MSRGN to demonstrate how each state within the region will overcome barriers to implementation of these following areas: long-term follow-up for newborn screening, telegenetics, improved access to primary care providers who have knowledge about genetics, access to genetic providers, family resources. Are we able to respond appropriately? So the Texas team's answer to that was scenario 2, Texas provides some long-term follow-up but needs more funding. Telegenetics now through Cook's Children's is available. The barriers are reimbursement for genetic counselors, lack of information on how to set this up, equipment, trained staff, contracts with area hospitals, and I believe that was referring to telegenetics as well. Access to PCPs with genetics knowledge, a training module, and other ways to improve genetics knowledge among providers is needed, and how to motivate them to take the training was one of the questions. Is there anything to add on that from Daphne or Dr. McLean that maybe you can think of that we want to add to that scenario 2 on those areas of newborn screening follow-up, telegenetics, or improved access to primary care providers that know about genetics? I know we're doing some of this work already with the San Antonio team, but anything to add for all of Texas?
I'm not sure I've got my head around the question very well so far. I'm taking it in.
Do you want me to reread it?
Yeah, I mean, so what are the scenarios? How does that work again?
So we're basically saying for that scenario 2 that HRSA, our funder, might come to Mountain States and ask us to demonstrate how each state within our region will overcome barriers to implementation of long-term follow-up for newborn screening is one category. Telegenetics would be another category. Improved access to primary care providers who have knowledge about genetics is a third category. Access to genetic providers is a fourth category, and the fifth category is family resources. So I think the team in the breakout session, they talked about long-term follow-up needs more funding. Telegenetics is now at Cook's Children, but the barriers would be reimbursement for genetic counselors, lack of information on how to set telegenetics up, equipment, trained staff, and contracts with area hospitals. And then on that, access to PCPs with genetic knowledge category, they came up with training module and other ways to improve genetic knowledge among providers, and how do we motivate them to take this training?
Right. Well, I mean, each one of those things are sort of enormous 3-hour-long lectures in and of themselves. For instance, the problem with PCPs, and I think we've talked about this in our sessions, is not the knowledge. I think they have the knowledge, but they don't know how to use the knowledge. Mm-hmm. They have the training or the experience. I think the analogy I used was riding a bike. There are a lot of people that know the idea of riding a bike, or maybe they've tried it once, but if you say, get on that bike and ride around the block 3 times, they'll say, oh, I'm sorry, that's not something I can actually be willing to do. So, but and the other sort of overarching problem with all of these answers is that the genetic workforce is so small compared to the needs that it's just by scale you can't get much done in terms of addressing things adequately. Even if you reimburse the genetic counselors better, of course that would drive more genetic counselors into the profession and make them more available, but we don't have enough. We don't have enough geneticists, and so that's the sort of overarching barrier to getting all this stuff done.
Absolutely, and as I think you've heard our management team say, Janet and Kathy and Celia, that our goal with this new cycle is not to further burden the small workforce that is out there in our region, spread very thin. So our thoughts with these teams are to hopefully empower the teams to come up with ideas that aren't going to cause more burden on that system, but rather let up on some of that burden from some other creative projects working on other areas that like this algorithm project to try to give them a little bit more useful knowledge of how to ride that bike, maybe around the block one time versus 3, right? So that your workload's not as heavy.
Yeah. Okay.
So.
And this is Kathy, time for a color commentary moment, perhaps. Truly, Scott, that first meeting, and we all dream big, and we need to fix that, and workforce is an issue, all that sort of thing. Really, because we have multiple states over a wide region, our hope is to just, as Christy said, to foster people who live and work in a state to say, well, I'm not going to fix that, but I bet I could fix a couple of clinics in my neighborhood that, or I could, with Department of Health can help us understand what Title V can really do for us, or it's really to identify a couple areas of low-hanging fruits, even if it's low volume and the whole state isn't better off for it. It's really to try and understand and it is about underserved populations, by the way. Arguably, people have said all of genetics is underserved. That's true, but HRSA's not buying it. They're looking for persons of color, persons who live in rural areas, cultural barriers, etc. But it is really to think big, but then narrow it down and see if there's an area that we can help facilitate with resources and $1,200 to make a difference somewhere to demonstrate some improvement for the underserved.
Right. Okay.
I'll just reach out to Daphne too. I know might be the first time you're hearing some of this information on the scenarios, but I know you wear 2 hats, both from public health perspective, educational perspective, and then also through your own personal experience. Are there any things that strike you or that you want to comment about on these 2 scenarios? And don't feel like I'm putting you on the spot. I'm happy to send you the scenarios so you can read them and kind of think about it and maybe respond back to via email if that's easier.
I think telemedicine is really in the future. I think that's the way that a lot of things are going to be going, and to hook them up with a specialist is very helpful, especially for the underserved populations in rural areas or like El Paso, way far away, who may not have anyone. As far as primary care providers with genetics knowledge, we have found very few in our, speaking with the population that we serve. Let me put it this way. I get phone calls every day from people all over the country wanting to know a physician who knows something about vascular Ehlers-Danlos syndrome. So it's, and it is challenging. So I'm just going to sit back and listen and
no problem.
Figure out how to get them to ride that bike.
Thank you for your perspective, Daphne. I appreciate that. All right, so I'm gonna go on to the last 2 points of our notes from Austin, which were that Texas Department State Health Services does fund programs and resource fairs to try to reach underserved, and I believe those some of those I know of come through Title V. For instance, I know Susan Fernbach through Baylor, I believe, has get some funding to do some of those resource fairs to reach underserved through Baylor and Texas Children's. And then next steps and how Mountain States can help the team would be create team and select a lead, get info for the website. Funds for long-term follow-up need to be addressed. Mountain States MSRGN needs to come up first for those searching for genetics info in Texas. Provide training modules, logarithms, participate in medical societies as resources. So that's kind of in a nutshell what was presented in Austin. And again, Rachel did the presentation, but I know Kimberly was there and Bill and a couple other folks. So that was what was presented in Texas, in Austin for the Texas team meeting. And we just wanted to confirm that this is what we heard. But then going forward, we went out to also set expectations for our March team call. So the idea was to gather the entire team in March. So any folks that are on this call now, and then those that are absent as well, and then start to be thinking on this call if there's anyone else that we are missing, any other areas that we are missing that we would like to invite, that you all would like to invite to the team. To be part of that core Texas state team. Now we've had some calls with some other states this week, and some folks have come up with a laundry list of people they want to reach out to, and they've decided, okay, we're going to define our core team as these 5 or 6 members, and then we're going to have ancillary people. So that's totally possible too. And we're not here as Mountain States to dictate who's on your team. It can be who you all feel needs to be on that core team and that ancillary team. And you can reach out to as many people as you want, for information and to guide some of the projects. So I just wanted to put that out there. I also wanted to let everyone know that I did get a contact through our Facebook page of a consumer in the El Paso area with a child that was picked up on newborn screening that is interested in getting involved with Mountain States. So I did not invite her to this initial call, but if I'd like to just throw it out to the group that she is interested and willing and in one of those areas that's been identified as an underserved area. So I just wanted to throw that out and see if the group would like me to reach out to her again and see if maybe introduce her to the team members or see if she'd like to be part of this.
And this is Kathy. Let me just add the color commentary piece as you get your head around this sort of team thing. So we're not seeking to create some sort of official structure with letters of invitation and certificates, et cetera, et cetera. The practical point is, as we talked about the point of contact earlier as well. So if we wanted to let state teams know that HRSA is thinking about everyone needs to say telehealth and what they're doing in their state, I'm making this up, but it's a buzzword. So we would anticipate we'd keep a list of the point of contact in each state. So that would be the point of contact person. That point of contact isn't responsible for answering, making it so, deciding what's going to happen, devising it's just a point of contact to let the rest of their group know. The state team would be a listserv that if that point of contact said, or if, from a regional level, we said, we want to let everyone who's on, kind of really involved with Mountain States on a state team know that's whose names are on the email list. And I think of it from your perspective as those are the folks that if we have something coming, out of the region and out of this HRSA project, you want these 5 or 6 people to always hear about it. It might not be their area of interest. It might not, they're not doing pediatric metabolic, but they're involved enough with kind of the activities overall that they'd want to hear if there was an educational module or an echo opportunity for a primary care doc. So it's that sort of, we don't want to populate anyone's inbox with information they're not interested in, but it's the group of folks that you think are most likely to want to hear every time there's sort of a Mountain States opportunity. Maybe they'll take advantage, maybe they won't. And then there's another layer, if you will, of people that, we'll reach out to. You'll only reach out to if it's telehealth. We'll only really reach out to them. They won't get a bunch of other emails unless it's about primary care in El Paso. So it's not so much about membership and who's who. It's who do we reach out to, who do we not fill inboxes for, and who do we really want to consistently communicate to about the Mountain States and the project opportunity. So that's sort of the context of how you might think about how people join, quote unquote, the team, or at what level you'd want them to have constant contact. I don't know if that made sense or not, but that's sort of the concept and why we're asking.
So with that said, does anyone have any ideas on who might be missing from the team that would need to be added?
Okay, this is Daphne again. And I'm just wondering if you're looking at telegenetics, especially for community hospitals, community hospitals are going to be the places where people in rural areas go, or like El Paso, because they don't have access to like medical centers. So have y'all thought, this is going to cost them funds. Have y'all thought about reaching out for maybe consulting for anyone who is in healthcare administration and community hospitals? Because they're going to be able to give you a pretty good idea of how that's going to be received in community hospitals.
So this is Kathy. What I'd say is I don't have a specific answer to that idea, but it's a great idea and a great suggestion. So what we have to, from the network perspective, is we have, poor Annette's like, oh no, this is like the 7th team and I've got a laundry list already. But we have resources insofar as we have people from kind of the network level that could and have reached out to certain clinics, certain primary care groups. We've done structured interviews with identified families, different places. So we have resources insofar as we have personnel that could, in fact, conduct such a survey or reach out or do an in-depth interview with several representative community hospitals. What we need from you guys is which hospitals would you want to know about, right? Is there one in El Paso that if they say it works, you think probably it will because they represent the toughest situation you can imagine? So we have resources that way. We have the state teams have $1,200 a year, by the way, which you can spend by May 31st, and then another $1,200 comes your way for the next grant cycle year. Now that doesn't buy a whole bunch, but if the state of Texas folks say, you know, if I could just give $500, I could attend that community hospital forum where I could get on the agenda and have an hour-long focus group to talk about this, or we send someone to hold that. But what we don't know is who to reach in your state. That's why we're focusing on folks who actually work in a state to know who you think we should reach out and touch and or support you guys is doing so if your work permits it or it's of interest to you. Does that make sense?
Yes, there are several large hospitals and medical centers that are working telemedicine already with community hospitals and providers.
Yeah, and we're aware of Cook and other that have been involved with Mountain States even before around telehealth around Texas. But there was, I think, outreach to be planned. Christy, correct me if I'm wrong, even to the El Paso area. But I think it was deemed at this point to be not really feasible for Cook. But so yes, this is true. And as to the extent that you guys become aware of them and just make a note of it, send it to us, to Annette. We can help to explore and do it. We don't have a lot of bucks, but we got people that can help to do that kind of legwork. We just kind of need to know where to start and to make sure you guys are in the loop, because ultimately it's going to be you guys on the ground level interacting with them if there's a possibility.
And this is Christy. That consumer that I spoke with she reached out to us, like I said, through a Facebook post. Her husband, she said, works in healthcare, and so he is actually part of his job is to be in contact or have meetings with hospital administrators at the local hospitals. So she said that could also be a help that she and her husband could help. So they're willing to help any way they can. They want to raise awareness. They want to talk about their experience for care. They're just interested. So just kind of piggybacking off what you're talking about, Daphne, he has some of those contacts is what she relayed to me. Now I didn't get into an in-depth conversation with her, but again, we can sit and Google all day from where all of us are located, but folks that are living and breathing and walking this walk in Texas are the feet on the street that can inform us to say, where do we start, like Kathy said. Does that make sense?
Oh yeah.
Okay. All right. So we've gone over the notes, and I just wanted to kind of go over what we'll be talking about in March. Kathy's already given a prelude to it, that we have $1,200 and our fiscal year ends on May 31st. And so each team gets $1,200 per grant year. And so per grant year that Mountain States has funded, which we've just started a 3-year grant cycle. So we are in grant year 1, which will end on May 31st. And not that you can't have to spend it by May 31st, not that there's absolutely no carryover, but we're really trying to get teams to start thinking about what they want to designate those funds for. So the rules are no alcohol could be purchased with that, and no lobbying. So with those two caveats, some teams have, decided they're going to buy some magnets, and others are thinking about, asking about direct services. Can they buy direct services of a person? We are looking into all those things for disbursement and how that would all look and work. But we really just want the brainstorming to begin of how and on what Texas would like to allocate those funds for at least this grant cycle. And to do that, we hope to do this March call with the whole team assembled to really try to take this broad perspective, as Dr. McLean said, a 3-hour lecture on each of these topics, and how do we bring it down to the priority level of, okay, we want to start here on this project first, and reaching under that umbrella of reaching the underserved with genetic services, and where are we gonna, where's Texas gonna start, and then what can Mountain States do to support that. So that's our goal of the March meeting, and Annette's already started sending out invites for those, so be looking for that in the coming weeks. But the other thing I want to go back and revisit is we just want to make sure we've invited everybody that needs to be invited to that call that you all would like on the team. So Daphne's brought up the idea of a telegenetics or telemedicine type person. Do you know of anyone, Daphne, that we might you guys would want us to reach out on their behalf, or one of the team members on here would like to invite?
I know several different hospitals that have them, so let me think about this one.
Okay, no problem. Sounds good. How about Dr. McLean and Kim? Do you guys have any ideas of people any gaps you're seeing from when you look at the team? As I mentioned, we do have a Title V person that is willing to be on the team, Ivy from the Department of Health, and then we've got Debbie, Bill, and Rachel also from the public health side. Have you all representing the genetic provider side, and we've got Daphne and Bill, coming from the consumer side perspective as well. Any thoughts?
Can't think of anyone.
Would there be anyone from any of the nonprofits that might have a stake in the game, like March of Dimes?
That's definitely an option. Do you know of any? Do you work closely with anyone in Texas?
It's been a while, and I know they've been interested in newborn screening at many different levels. But we could, I'm sure there's someone that Debbie Friedenberg knows. We could float that by her. Maybe somebody in Austin who's also connected with sort of policy work that might be useful.
I do know one of our consumers, previous consumers in the collaborative cycle, Joe Martinic is from Texas and lives in Austin, and he's done quite a bit of work with March of Dimes. So he's been already connected with our organization as well. He's a lawyer, but he's not a lawyer for them, but on their staff. But he's connected with them through his daughter's experience with PKU.
He was formerly the chairman of the Interagency Council on Genetic Services in Texas for a long time in the like 1990s and stuff.
Mm-hmm. Somebody was trying to speak. Sorry, didn't mean to interrupt them.
This is Rachel.
Okay,
Hey.
Rachel, thanks for joining us. Guess what? We nominated you as the team lead.
No, you did not.
It's up for vote.
Last time, Bill Morris and Dr. Friedenberg actually were interested, and of course, we always want to have Dr. McLean as the team lead as well.
Well, he's the one that nominated you. Anyway, thanks for joining us, Rachel. I know we're busy this morning, so thanks for hopping on.
No problem. I heard a little bit about March of Dime, and yes, we do have a couple contacts with that we are in I guess regular interaction with from March of Dime. So I can definitely chat with them to see if they are interested.
Sounds great.
Christy, this is Kathy Hassel. My apologies. I'm going to have to drop off at this point, but way to go, Texas team. Thank you very much, and we look forward to working with you going forward.
All right, thank you.
Okay, thanks.
Good. All right, I'm just writing that here in the notes. Rachel, thanks. So can I put a note that you'll follow up with that, Rachel?
Yes.
Unless Dr. McLean, did you have any other names, or is that okay for Rachel to take the lead on that?
No, I think that's fine. I just think that, Bill may have some other ideas, but sometimes other advocacy groups look at things in a little different way and can be very helpful. Cystic fibrosis groups sometimes have a lot of savvy when it comes to moving things along and prioritizing what we can do. But I'm just thinking of it right now. I don't have any specifics in mind.
Okay. Perfect. What's the team's thoughts? And I'll give Rachel just a quick snippet. What's the team's thoughts of inviting this other consumer that's reached out to us from El Paso? Rachel, we had a consumer reach out to us from the El Paso area through the Facebook page, through a post on the Facebook page, just saying she would love to be involved in any way that she could with Mountain States and awareness. Her son, I believe, was picked up on newborn screening and is, I think, around 5 or 6 now. But they live in the El Paso area, and her husband's in healthcare and works a lot with the administrators of a lot of the area healthcare organizations and hospitals. And since El Paso came up as an area that was identified as underserved, I just wanted to find out if the group would like me to further reach out to her and include her on further conversations, or what your thoughts are.
I think it's great. I would never say no to anybody who wants to volunteer to help.
That's kind of my thought. What about you, Dr. McLean and Kim and Daphne? Is that okay with you?
Well, I think that whenever a consumer steps forward and offers help, it's too precious a resource to ignore. I would just want them to, they may not really understand what this whole big picture is all about, so they would need a lot of sort of background conversations with you or with somebody to get them oriented to exactly what we're doing and what the goals are. This is jumping in sort of fresh and not knowing the context. It may be, or they may be all over this. They may really sort of get it, but I think they should be invited to join us, with the caveat that they probably need some guidance on what we're doing and find out a little bit more about what they are interested in.
Absolutely, and I can do that. I already gave her some orientation just to Mountain States in general. She actually found out about us through different times. I'll share some of our stuff in the Organic Acidemia's online support group, and so she's known about us through that. And she also shared that they've had some experience. I can't remember the condition. I have it written down somewhere. I don't have it in front of me right this minute, but the condition that her son had, as far as triaging in the ER and getting care through protocol letters and things like that, where they were having long wait times and things before. Sounds like she's navigated that for him successfully with the small community hospitals. So seems pretty savvy in that area, that she's had some challenges and barriers for care for her child and work through them. So just I'll reach out to her and just get her ideas. If you kind of explain what the state teams are doing, I can share that state teams one pager with her that outlines some of the goals of the state teams and those scenarios, and see if it's something that she would be interested in. That sound good?
Good.
Okay. I will make myself a note to reach out to her. I believe her name's Amanda, but I don't have it. Again, sorry, I apologize. I should have had that in front of me for today's call, but I don't have it right in front of me. But I was so excited to get a message through Facebook of somebody who wanted to help. Sorry, those are the kind of things that say, okay, it's really working. What we're doing is really reaching somebody out there. All right, so we're coming up on just 10 till the hour, so I just wanted to wrap up with, are there any questions, comments, concerns? And just to, again, put a little bug in your head that we'll be scheduling that team call in March to try to get everyone that we'd like on the team, that you all would like on that team, on that March call, so we can talk specifically about Priority Project and specifically about how to allocate the $1,200. But any questions, comments, or concerns as we're wrapping up?
Are you going to share notes with us after you're done?
I am. I've been taking them on the screen, Rachel. We went over what you presented in Austin, and there were comments additional to that. So I've been taking those notes on the screen, and I will share those after the call.
Thank you.
Okay. And a couple of our other team meetings, they have decided that they want another call with themselves to maybe talk before the March call. That is completely up to you all. We are here to help you do that if you need that, if you need us to set up a Zoom line or whatever, but we don't have to. Some of the teams are just like, okay, well, we have the email list, we'll just circulate a conference line and we'll all talk, because they wanted to kind of narrow down their choices of what they wanted to work on as a team or spend the $1,200 on. That is completely fine. We don't have to be involved in that, but we're happy to help if you need that. So from our perspective, we'll be sending out, Annette will be sending out a doodle poll if she hasn't already. I think you sent those out, maybe, Annette, for a March call, and we'll include the new folks and any folks that we identify. So Rachel, if you do identify somebody from March of Dimes, let us know so we can include them on that March call invite.
Will do.
Perfect. All right. Any other questions, comments, or concerns?
No, I'm just impressed that you're done within an hour.
I had a 7-point agenda too. That's pretty good, huh?
This is amazing.
All right. The other thing we're using Zoom for, just so you all know, we have a Zoom account through THI. You can record calls for Zoom. So I did record the call today. So Rachel, since you've been halfway through, I'm struggling right now. The file size is pretty big to email. My email keeps kicking it back. So we do have a YouTube channel, so I'm able to upload those, I believe, and not have them open to the public, meaning that you couldn't search this call. It wouldn't come up on our Facebook page. But I can try that if need be. But just know that for future, that if there's people that can't attend and you want to record a call, and then that way people can go back and watch it with the online on screen presentations as well. That's an option, and we have that available.
All right. Thank you.
No problem.
I do have a question, Christy. This is Daphne. Is there an email list of people on the team?
I will send, when I send out the notes, I will add you to that, and you can see everybody's email.
Okay. Thank you.
You're welcome. Yeah, I apologize, Daphne. I had already sent out the team call, so I think I might have forwarded it to you. If you scroll down for that invite, the emails might be there, but I'm not sure if it mask them or if it showed them, or if I just cut and paste the Zoom stuff for you. But when I do the notes, I'll make sure that everybody's on there.
Okay, thank you.
Okay.
Daphne, this is Annette. Did you get a doodle poll from me on Wednesday?
No.
Okay, I'll send you that as well.
And did everybody, we should check with everybody else. Did everybody else get a doodle poll from Annette?
I didn't. This is Therese.
Oh, hi, Therese.
Hi.
Did you join?
Thank you. I'm sorry, but oh, never mind. I thought this was canceled. It showed up as canceled, and then I saw your email, so I apologize. But here I am.
Oh no. Okay, sorry. Well, we're just finishing up, but I was just saying I recorded the call on Zoom. So
yeah, I got you. I heard you. So that was good.
I'll go ahead and upload it to YouTube since you and Rachel could probably benefit from that.
Great. Thank you.
No problem. So I'm hearing that no one else got the doodle poll. Did anybody else get a doodle poll from Annette?
What is it?
On Wednesday?
On Wednesday.
It was either Wednesday or Tuesday. I don't know when I sent it out.
Oh, I got one. I don't think I got one this week, but a while ago I got one to set up this call.
You got one for this call, yeah. Yeah, we'll double check, Annette. I didn't get one either, so it might not have gone out for Texas. Okay. All right. Well, you guys get 8 minutes back of your hour. How about that? All right. I'll go ahead and get these notes out and upload the recording to YouTube and try to include that in the notes as well, so you guys will have the recording of the call. But we appreciate Texas so much. You guys are awesome, and hopefully for the March call we can have everyone on that call, and lots of discussion about what next steps are and how Mountain States can help. With as Kathy says, the low hanging fruit, but no need to think outside or inside the box, because there is no box. So the sky's the limit. And $1,200.
That's the limit.
What was that?
Box then.
What was that?
Supposed to spend $1,200 on making a box.
Yeah, there is that box. All right, everyone have a great weekend. Thanks for joining us today.
Thank you,
Thank you.
Christy.
Okay, no problem. Talk to you later.
Okay,
Bye-bye.
bye.
Bye.
Hey, Christy.
Oh, yeah, hang on just a second. Annette, call me on the phone. I'm going to end right now.